Welcome back, UPSC aspirants. You are tuned in to another focused explainer brought to you by Rungta IAS Academy. I'm here with Ma'am, and today we are diving into an absolute data goldmine for your mains preparation. We're looking at the National Statistical Office's 80th round of the Household Consumption Health Survey for 2025.
Hello everyone. So it is absolutely right. This right here is one of those high-yield topics that you literally cannot afford to skip. We are going to decode these statistics straight from the source and we'll show you exactly how to use them to fetch maximum marks in your papers. Alright, let's dive right in.
Here's our structured agenda for this explainer. We're going to start with a quick syllabus mapping, then move on to health-seeking behavior, the all-important out-of-pocket expenditure, India's epidemiological transition, assessing government schemes, and finally, your strategy for mains and the interview.
So starting off with Section 1, Syllabus Mapping for GS Paper 2. Now, before you start cramming any data, you have to know exactly where to apply it, right? This explainer is perfectly aligned with your GS Paper 2 syllabus. We're talking specifically about the issues relating to development and management of social sector or services relating to health. And you know what's truly compelling here? It's the sheer scale of the data. The NSO actually canvassed 139,732 households. That covers 76,296 in rural areas and 63,436 in urban areas. When you're writing your essay or your mains answers, quoting this massive sample size validates your entire argument. It basically tells the examiner, look, my analysis is grounded in comprehensive nationwide evidence.
Moving right along to Section 2, Decoding Health-Seeking Behavior.
Okay, let's see what the numbers are actually telling us about citizen awareness at the ground level. If you look at the proportion of population reporting ailing, or PPRA, it has almost doubled from 2017-18 to 2025. In rural India, it jumped from 6.8% to 12.2%. And in urban areas, from 9.1% up to 14.9%.
Exactly, sir. And aspirants, please listen carefully. Do not interpret this in your answers as, oh, India is getting sicker. No. You need to frame this as a highly positive indicator of improved health-seeking behavior. People are just way more aware now. They are much more willing to report their ailments and actually go seek medical help than they ever were before. It's a huge step forward.
Let's shift gears to Section 3. The fall in out-of-pocket expenditure, or OOP. Now, we come to the financial burden of healthcare. We all know this is a perennial favorite topic for UPSC examiners. So the absolute crucial point you need to remember is this figure, 11,285 rupees. That is the median OOPE for hospitalization in 2025. So what does this actually mean for us? It indicates that for over half the country, the expenditure for hospital stays remains relatively low. Those really high-cost cases, they're actually outliers that end up pushing the average up. But the median? The median tells us that catastrophic health expenditure is genuinely being contained for the vast majority of people.
But honestly, here is the truly spectacular statistic. Are you ready? The median OPE for non-hospitalization, meaning outpatient care, in public health facilities is 0.
Absolutely 0. A massive proportion of our citizens can now access essential outpatient healthcare entirely free of cost. On top of that, the survey notes that more than half of the hospitalization cases in public facilities incur only about 1,100 rupees. Aspirants, this is a literal game changer for your social justice arguments in the papers. Make sure you use it.
Let's jump into Section 4, India's epidemiological transition.
Okay, make a big note of this exact academic phrasing. Epidemiological transition. Use this in your mains answers, and it will absolutely fetch you those extra marks. This concept perfectly highlights India's dual disease burden. The survey clearly documents a decline in infectious diseases, which is great, but simultaneously, it shows a rising prevalence of non-communicable diseases, or NCDs. We are talking about things like diabetes and cardiovascular conditions. This shifting baseline basically means that our public healthcare demands are changing right before our eyes, and we are going to require much more long-term, specialized care moving forward.
Which brings us to Section 5, Assessing Government Health Schemes.
So, how exactly is the government responding to this massive transition? Let's link the data directly to policy interventions. You really need to memorize these statistics, folks. They are your direct evidence of successful policy implementation. Rural coverage under government health schemes jumped phenomenally from 12.9% all the way to 45.5%. Urban coverage? That rose from 8.9% to 31.8%. Institutional deliveries are basically universal now. We're looking at 95.6% in rural and 97.8% in urban areas. and rural public facility usage for outpatient care grew from 28% back in 2014 to 35% in 2025.
And what is the primary catalyst driving all of this incredible growth? It's schemes like Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, or PMJA. Because they are supported by the availability of free drugs and diagnostics, these state and central schemes are actively providing real financial risk protection. That is exactly why we are seeing that 0 rupee median outpatient cost and the big surge in public facility utilization that ma'am just mentioned.
And finally, Section 6, Mains and Interview Strategy.
Let's synthesize all these fantastic statistical insights into a strategic roadmap for those final hurdles of your UPSC examination. To wrap this explainer up, I want to leave you with a very direct, interview-style question to ponder. How does the success of PMJA and the drastic drop in out-of-pocket expenditure alter the narrative of public healthcare reliance in rural India? I really want you to think about that carefully. It signifies a very tangible transition toward universal health coverage. Use these NSO 2025 metrics to build highly analytical, data-backed answers. Thank you so much for joining this explainer from Rungta IAS Academy. Keep your focus sharp, stay consistent, and we wish you the absolute best in your rigorous preparations.